After years of falling out of favor, the intrauterine device is making a comeback as a popular form of birth control in the U.S. The device does have some benefits over oral contraception as well as some drawbacks. And here to discuss them all with us is ABC News contributor Dr. Jacques Moritz. Dr. Moritz, great to see you.
Good to be here.
Tell us, first of all, what exactly is an IUD?
Right. Well, an IUD is an intrauterine device. It's a little piece of plastic. Let me show you. I brought you one here. So this is, it's not this whole thing, it's just this part here. This anchors this inside the uterus. This specific one, Marina, we're going to talk about it. It has a little bit of hormone here, and this is it. It goes in. This one stays for 5 years. There's a copper one that lasts for 10 years.
So those are the two kinds of IUD.
There are only two in this country. Some countries have 10 different kinds.
And is one better than the other?
I'll tell you, the copper IUD has no hormones. So for women that don't want any hormones, the copper IUD is the way to go, except they can't have heavy periods. And what happened is that's a whole group of women that have heavy periods. For those women, the Marina is a lifesaver. You have no periods with it. You have, if you do, you have very light periods, and it is actually used in other countries to prevent hysterectomies and to prevent endometrial cancer.
And how exactly does it prevent pregnancy? Does a mini abortion occur?
Exactly. Well, that's a major misconception. No pregnancy occurs. The way it works is it kills the sperm. The copper causes inflammation. The progesterone makes the mucus very thick, and neither way can the sperm go through. So now, there's no religious concerns with this.
Now, is some of that sort of myth the reason that it fell out of favor?
Right. No, it fell out of favor because doctors like me were trying to make a better IUD, and they messed it all up. They came out with one called the Delcon Shield. It's off the market. Caused a lot of problems. That's gone. And we've actually gone backwards and gone to some of the older type of IUDs.
And so now they're rising in popularity.
But the numbers were about 10 years ago 1% of women. Now it's up to 10%, and I think it's going to be more and more. This is a great form. If you ask any OB what they use or what their wives use, it's an IUD.
So who's an ideal candidate and who shouldn't use an IUD?
In the past, it was only thought in this country for women that had kids. That's all changed now. Basically, everybody is a candidate.
And let's say you decide you want to get pregnant. How quickly after you take out the IUD can
you always have the good questions. You pull it out,
that's it,
and you're ready to go.
Wow.
Yeah, there's no waiting period. There's no hormones getting out of your body. Then I usually tell people wait for the next cycle, which comes very soon, and that's it.
So it sounds like there's very little downside here.
There is. I mean, there's initially when you put it in, it's a procedure. There is some pain. If you've had a child, putting an IUD is very easy. If you have it, it takes some skill. After that, the periods are a little bit heavy for the first 1 or 2 cycles, and then they go back to normal.
And how long can you leave it in?
Well, one is for 5 years, the Marina, that's this one here, and the copper one, 10 to 12 years.
And no risk of infection with something
no, actually,
that long?
The risk of infection is during the insertion, and sometimes we give antibiotics, just 1 dose, and after that, low risk of infection.
So you think that this is really the way to go for most women?
Oh yes, this is what I mean. This is it's going to rise in popularity. In this country, they're very big on using pills. In most countries, IUD is the first choice.
Very interesting, Dr. Jacques Moritz. Thank you so much.
Good to be here.